Hi everyone, welcome to our careers webinar. My name is Rebecca Northeast and I will be your host today for our How to Use Your PhD. And today I've got five really exciting speakers who have all done a PhD at some point, and what they're now going to talk about what they do. And they come from a really diverse background of roles at the moment, so I think that'll be really interesting for everyone to hear. Just a few housekeeping points. If you have any questions for the speakers, please do write them in the chat box, or we have also enabled the Q&A. Each speaker will have the opportunity to answer one or two questions immediately after their talk, or at the end, in about an hour and a half, there will then be an open discussion, so we can talk about any questions then. So please do write as many questions as you like. This is being recorded and we will send you the slides afterwards. So if you miss anything or you have to drop off, no worries, we can send you the recording. So let's get started. I will start with a really quick company introduction. So we are Proteintech, the company that's hosting this. And Proteintech is a leading life science reagent company, and we have products which comprise across three core product lines. So through our Proteintech brand, we sell our antibodies and immunoassays. So we have antibodies against 13,000 human targets, as well as a wide range of ELISA kits and IHC kits. Through our Humankind brand, we sell our recombinant cytokines and growth factors, and these are HEC293 expressed, which is a human cell, so that means that they have native folding, post-translational modifications, and glycosylation, so they actually means they have higher bioactivity. And then through our Chromatech line, we sell our nanobody-based reagents, which, as the name suggests, are much smaller antibodies. And these are excellent for things like immunoprecipitation of tag proteins, as well as super resolution microscopy. So who have we got for you today? I'm really excited to introduce our panel. So first up, we will have Praveen. Praveen is the director and co-founder of Pint of Science. This will then be followed by Rhys. Rhys is a senior clinical scientist at NHS England. NHS is the National Health Service, which is the main branch of health service that's done in the UK. Following that, we will then have Micah. Micah is based in the US, in the States, and he is a research administrator at Northwestern University. Next, we'll then have Josie, and Josie recently graduated to her PhD, and she is now a research manager at Manchester University. And then lastly, we will have Claudia. Claudia is a project manager for Model AD, and I'm sure she'll tell you more about that. So that was a really quick introduction, and I'm going to stop sharing and introduce Praveen. As I said, Praveen is the director of Pint of Science, and I'm sure she'll tell you all about her story, and I'm really excited to hear it. Next up, we have Dr. Rhys Jones, and Rhys is a clinical scientist for NHS England. And for those of you that aren't aware, NHS is the National Health Service, which is the primary healthcare. It's free public healthcare to everyone in the UK, and it's one of the UK's biggest employers by far. So over to you, Rhys.
Great, thank you so much, Dr. Northeast. Hopefully you can see my slides. Have they come up all right?
Yep, I can see them.
Brilliant. Okay, so my name is Rhys, and I am a senior clinical scientist based in the Department of Clinical Biochemistry at Salford Royal Hospital, which is in Greater Manchester. And today I just want to provide a little bit of insight into the NHS Scientist Training Program. Essentially, what is the NHS STP and why might you want to pursue a career as a clinical scientist? I'll talk through a little bit about my background, my journey to becoming a clinical scientist, and the application process. And I'll also provide an overview of my current responsibility and some key projects I've been involved in. And then finally, I'll end with just a few future career opportunities, like where can this role take you? So as I've just mentioned, the Scientist Training Program is a 3-year formal training program, and it consists of both work-based learning and also the completion of an accredited master's degree relative to your chosen specialism. And for me, that meant that I was employed within the Department of Clinical Biochemistry at Salford Royal, and I completed an MSc in Clinical Science at the University of Manchester. I guess as people have completed a PhD or have come towards the end of their PhD, you might be thinking, why do you need to do another master's degree? And what I will say is the master's that you get taught as part of this program, it's highly tailored to the role that you'll be doing. So all knowledge and all topics that you'll be covering in that master's degree is relevant to your day-to-day role. And it's really important that you have that knowledge available to do the role successfully. And then you do this program with the end goal of obtaining registration with the Health and Care Professions Council as a registered clinical scientist, which is a protected title within the UK. And in order to achieve this, you need to provide evidence of your work-based training, which is documented on an online platform known as OneFile. You need to complete the masters to a satisfactory level, which is a pass, and also you need to have a final assessment of your competence. So for me, that was a reflective writing piece based on the 5 domains of clinical practice and also a Viva-style interview. But compared to a PhD Viva, this was much shorter and also less intense. So there are many available specialties that you can do this program in. As I've mentioned, I did clinical biochemistry, and this is within life sciences. And within that sort of specialty, you've also got other blood sciences. You've also got physiological sciences, such as audiology, but these are more patient-facing roles. But you can also do the program in physical sciences, such as clinical engineering and informatics. The actual topics you cover depend entirely on the specialty you choose. But for me, I would cover things such like endocrinology, diabetes, toxicology, pediatric biochemistry, and nutrition. So I guess as you come into the end of your PhD and thinking about what to do, you're wondering why you might want to consider this as an option. So for me, you get to work within a field that you're passionate about and also in a subject relevant to your degree. You can directly support patient management and improve healthcare. So I did my PhD in arthritis very broadly, and I did that because I wanted my research to benefit patients. But you soon realize when you're doing a PhD that the work you're doing is largely detached from the patient population you're trying to support, whereas in your role as a clinical scientist, you have a direct impact on patients and their care on a daily basis. And to put this into context, in the lab that I work in, we receive more than 4,000 samples each day from a variety of locations, such as general practice, community teams, and inpatient and outpatient hospital locations. As I've mentioned, you complete a master's degree, but this is fully funded and not something you'll have to pay for. And in terms of your employment, you're initially employed on a fixed term contract within the NHS with a starting salary that's quite comparable to a postdoc, but this progresses quite quickly. So after those 3 years, you can progress to a senior clinical scientist on a permanent contract. And then moving on from that, you might want to aim for a principal clinical scientist and then a consultant. And then there's potential to obtain roles as clinical director within the health service. So just to talk about me, so I did a very long time ago now, clocking that date, an undergraduate degree in biochemistry at Cardiff University. And following that, I did a 3-month lab-based placement in the Institute of Tissue Engineering, focusing on osteoarthritis, again at Cardiff University. It was actually at this time that I applied for the NHS SDP for the first time, but I was unsuccessful. And in hindsight, I probably wasn't ready for the role. And instead, I completed a 1-year graduate training program in leadership in an O2 store. And during that time, I just really thought about what I wanted to do. But shortly, a few months after starting within that role, I realized my passion was in science, and I went to complete a Master's of Research in Translational Medicine at the University of Manchester before pursuing a PhD in Immunology at Birmingham. So I applied for the NHS SDP in my final year of my PhD, and I obtained a place at Salford Royal where I work now, and that started in 2018. And then in 2021, I was registered as a clinical scientist and started my role as a senior clinical scientist, which is what I'm doing at the moment. So I briefly just want to touch about the application process, just because it is very detailed, and this is just a very brief summary. But at the end of my talk, I have provided some links to resources where you can find more information. So applications open in January of each year. You can actually register right now as well, so you can be kept up to date with key dates for application opening and closing. And then that's with the aim of starting your role in September. So the application's open just once a year. It's an online application, and you choose your specialism, such as biochemistry, and then you complete an online application form to demonstrate your qualifications, experiences, and also motivation for applying. This is normally in a number of competency-based questions. Your application is scored against a person specification. So if you do go to apply, I'd make sure you cover all essential requirements that they ask for. And then in addition to this, you complete a situational judgment test, which gives you a series of scenarios where you strongly agree, disagree, and so on. And that gets scored as well. And then together, the score from your SJT and your written application go towards whether you get an interview or not. So I guess most importantly for today, it's about talking about my day-to-day responsibilities. So I'd say they're categorized by both clinical, analytical, and leadership roles. So clinically, I review patient results that come through the laboratory and provide clinical advice to teams and service users. I also attend multidisciplinary teams where we discuss complex cases. I'm on a duty biochemist rota, and that's a large responsibility where you oversee the entire laboratory and deal with any issues that may arise. And I'm also a lead scientist in toxicology, so we report any results related to drugs of abuse. I also have an analytical role where I review internal and external quality assurance data for our current tests, and we also develop new methods and I perform validation. From a leadership perspective, I'm involved in lots of project management. So I guess unlike a PhD where you do probably 1 or 2 projects in great amount of detail, I'm involved in lots of projects. So you have to find a way to manage that and delegate where applicable. I'm also the audit lead for the department, so I oversee audit activities. And I'm also part of the governance team where we assess risk and monitor actions for improvement. And then as you increase with your experience, you might be involved in mentoring junior staff and also direct line management. So just for points of interest, I just wanted to include some key projects that I've been involved in that I thought were worth mention. So I've been involved in the implementation of fecal immunochemical testing. So this is an immunoassay that's used to triage patients with suspected bowel cancer, but do not necessarily meet the criteria for referral for a 2-week wait pathway. So this involved ensuring analytical performance, liaising with clinical commissioning groups outside of the laboratory, and also providing information to patients in lay terms. And then I also performed a clinical audit on the impact of this service. During coronavirus, I was also involved in the rollout of point-of-care devices to monitor blood gases in patients in ICU in the hospital setting. So we validated the performance of these devices and delivered training to clinical teams. And then more recently, I've been involved in the method development of measuring androgens by mass spectrometry, such as testosterone and androstenedione, which is used in the diagnosis of PCOS, androgen-secreting tumours, and also monitoring patients on a testosterone replacement. And then just briefly touching on future career opportunities. So with this role, it's a constant path of learning. And if you do want to progress through senior, principal, and even consultant positions, you do need to complete some more examinations. These are known as FRC Path, and they're split into part 1 and part 2. So for part 1, it's a 125 multiple choice paper, and you need to pass this to obtain principal clinical scientist roles. This is where I'm currently sat, so I passed this exam in March, so now I'm looking for the next step in my career. But moving on from this, you've got part 2, which is slightly more extensive and includes practical examinations where you're given 19 questions and you need to provide answers, a written exam to demonstrate your ability to address analytical issues, and also you also need to demonstrate an understanding of clinical and analytical cases. And you need to complete all of this to obtain a role as a consultant clinical scientist. And then finally, if you didn't have a PhD, you would also have to do a practical project and a dissertation. But one of the advantages of having a PhD is it's something that you don't have to do, so you've already got that ticked. And then here I've just provided a page of useful resources. So if anyone does want to find out more about this role, you can look at any of these links for more information. But thank you for inviting me to speak today. I'm happy to take some questions.
Hi, Rhys. Thanks so much for that. That was really, really interesting. We have many questions for you.
Oh,
so
wow.
I think what I'll do is answer a few of the more broad ones. There's some very specific questions. And then what you could do maybe, if you don't mind, in the rest of the talk is just privately answer people in the chat.
Yes, I'm happy to do that, of course.
So one of the more broad ones is, when did you know that you wanted to be a clinical scientist, and what were your decision processes leading up to that?
So I think towards the end of my PhD, I was really open-minded in what I wanted to do. I did look at a few postdocs, I did go look around a few labs, but at the same time, I applied for the Clinical Scientist Training Program because it is quite a lengthy application process. You do have to prepare early and keep your options open. A couple of people in my existing PhD lab had gone down the route of doing the immunology specialism in clinical scientist, and they had always said very positive things about it. But I think the main things for me were I wanted a work-life balance, and I can say that I mostly do get that in my current role. So my hours are 9 to 5. I do go into work a little bit early, but it's by choice, but it's not an expectation. I also wanted career stability, so I'm on a permanent contract rather than a fixed-term contract that you might get in academia. And also there's defined career progression. So if you pass the exams that I briefly touched upon at the end, you're eligible to apply for these promotions, and that's it. So if the jobs come available for you to apply for, there's nothing stopping me from applying and obtaining a promotion. In fact, people normally rise the ranks quite quickly in this sort of profession as well. So I've only been in my role for about 18 months, but I'm already looking for a principal post.
Oh yeah, fast grower. That's really exciting. And yeah, thanks for a really comprehensive overview. I think many people can agree with you with the whole stability and work-life balance as well. Like I said, many questions, but another more kind of broad relevant one is when you're choosing a specialism, how close to your PhD can it be? So for example, if you have a genetics PhD, could you apply for a biochem role?
Yeah, I believe so. So the specifics of this are on the National School website, which I've linked at the end. So they have more information on the speciality and what they require. So for example, if you want to do clinical informatics, you might have to have like a mathematical component to your degree. But I know for clinical biochemistry, I had a biochemistry undergraduate, but any sort of blood sciences will do. A generic biomedical science degree might do. An immunology PhD, which is what I have. So yeah, it is quite broad. As long as it's related to the specialism you're applying for, they will probably accept that.
Another more relevant question to everyone as well is it's from Deborah. She says, sorry if I missed this part, but how much lab work do you do and what is your split between wet lab and office time?
Yeah, so it's very different to academia, where I think you'll be in the lab most of the time. You'll find as a clinical scientist, I guess, as you progress through your career, your time in the wet lab probably reduces, just because you probably delegate more responsibilities and ask other colleagues to obtain data for you to review. So at the moment, I would say I'm in the lab for maybe 2.5 days a week, and the rest of it is probably desk-based.
Okay. I think we've got time for one more question, and it was about the exams. And they said, do they provide any mock exam papers for you to do? Or how does sort of the exam revision work? Do they help you with it?
So it depends where you work. So it depends on your NHS trust. Some trusts provide, say, half a day a week for you to have some study leave so you can complete these exams. There's in the Northwest in particular, there's regional teaching, which is once a month. So each month, one hospital in the region will put an afternoon teaching session on, and that will support completion of these exams. And then on the FRC PAP website, which I've also linked at the end, they do have some mock papers. They also provide a broad curriculum to give you an example of topics you need to cover.
Fantastic. And I am going to ask you if you can possibly to reply to some of the questions in the chat. Someone's even asked for you to reply to all so that they can see the answers too. So thank you so much for your time, Rhys. It was clearly a very engaging career that you have, and a lot of people are interested. So yeah, thank you so much for your time.
That's not a problem. Thank you everyone for listening.
No worries. Next up, we have Dr. Micah Rahman-Enyart. And I probably said that wrong. Sorry, Micah. But Micah is a research associate, and I'm sure he will, research administrator, sorry. I'm sure he'll tell you all about it. So over to you, Micah.
All right. Okay, the slide's coming through clearly?
Yep, perfect.
Okay, awesome. All right, well, I want to start by thanking you all for taking the time to attend the webinar, and thank you to Proteintech for having me on the panel. I'm excited to walk you through this, I guess, pleasantly unexpected journey into research administration. The role of research administrator, kind of in a nutshell, is to manage the sponsored projects that come through a division or department. Important to note that this is not really a science or a research position. It is very heavy on the administrative aspect of it. So to start with a little bit of my background, I did 14 years at Indiana University in Bloomington. I got a bachelor's degree in athletic training in 2010. I took a couple years to work at a private medical practice before returning to get a Master of Science in Kinesiology with a major of human performance. And then I just kind of continued to ride that academic track to a dual degree PhD program. I finished that this past November 2022 and had degrees in human performance and neuroscience. And so the last 3 years that I was finishing up my PhD, I was also working part-time as a program assistant at Northwestern. And the division administrator there was kind of helping me to try and figure out different options to go with this PhD, and she mentioned research administration. So obviously that is the route that I chose. So I'll kind of go over some of the things that I like and that I don't like about research administration. In terms of the benefits of the job, I suppose, starting salary is pretty decent. I guess, let me rewind really quickly and just say this is very geographically dependent, obviously. So these things are true of Chicagoland and mostly seems to be the case from what I've seen throughout the US. So starting salary is pretty decent. It's more than you typically make as a postdoc, probably not as much as you'd make if you do go to something like an industry position. The downside to that is possibly earning potential. I put a question mark here because there's a lot of different kind of routes that you can go with research administration and in later career stages, and those will kind of impact your earning potential. There's never a reason that you have to come into the office in research administration. Everything is done digitally, grant submissions, and so on. And a lot of universities are offering fully remote opportunities. But the flip side of that coin is if you are somebody who's a little more gregarious and social person who wants that interaction, a fully remote position obviously wouldn't be ideal for you. There are still some that are offering, hybrid positions like Northwestern, where I'm at. They offer hybrid schedules, but the trend seems to kind of be going towards fully remote. There's a lot of schedule flexibility. So there's 4 major grant deadlines that happen once per quarter. And outside of that, you have a lot of flexibility to do what you need with your schedule and kind of make it work around the things that you need to do in your life. There's a lot of paid time off that comes with, an academic position. So you get all of the holiday and the vacation and sick time that come along with those. Most universities are also tax exempt, so they qualify for public service loan forgiveness. So, if you are someone that has egregious amounts of student loan debt, like a lot of us in the United States do, this is something that is definitely very appealing. And then last is job and salary security. So the salary security, you don't have to, write grants to get your funding. You do your job and you get paid for it. And there's job security in that, there's kind of a shortage of research administrators right now. So it is a position that's in high demand. And so some of the reasons that it is in high demand, the cons of the job, there's some role and workflow ambiguity. Because there's no concrete definition of what a research administrator does that's kind of globally true, it can be kind of difficult to figure out exactly what you need to do to excel. For instance, I know what I need to do at Northwestern in infectious diseases, but if I transfer divisions or departments or go to another institution, that might not be the case. I say there's some relative monotony. So new funding proposals are going to give you the opportunity to kind of, stimulate your brain and get new experiences. But there are some background tasks, just, maintaining compliance documents and kind of small tedious things that are associated with the job. I like to use this time personally just to kind of, listen to podcasts, keep up with local news, things like that. But if you're somebody who does need something kind of new and exciting every day that you step into the office, this would be a major drawback for you. And then lastly, onboarding support kind of goes into the role ambiguity, because the onboarding is designed for, a large general audience. There's some pieces of it that are more and less useful than others. So I'll talk about some of the actual individual tasks of the job. So I'll split it into pre-award, post-award, and financial. So the pre-award side, as the name implies, this is before we've received notification that that we're going to be funded. So you review the solicitations, see, is this a 2 or a 5-year grant? How much money is awarded? What kinds of things can we spend the money on? All of those details. If you're doing any subcontract work or a collaboration where you're subcontracting some of the stuff to a different university, you would kind of manage those subrecipients. You prepare the budget for the project. Coordinate IRB and IACUC protocols. Again, this kind of goes into some of the compliance documents. And then update other support. So other support is just a document for each individual PI that says, these are the grants that they are funded on and how much effort that they're committing to each of these grants. So on the post-award side, so after we've received notification, we're getting this funding, you manage the effort commitment. So if a PI says, I'm going to contribute 5% effort to this project, you make sure that they're hitting on that effort and showing productivity on it. You generate the annual progress reports, again, just to make sure that you're using the money appropriately and you are being productive with the money that they are offering you. And then award closeout. So there's some things like reconciling the budget and little things that you need to do as the award is ending to make sure that it gets closed out properly. So the financial HR side, you approve the expenses charged to the project. So, if a PI comes and says, I need these supplies and it's going to cost this amount, you have to make sure that it's in the budget, it's allowable by the sponsor, all those little details, and then approve or deny those charges. You oversee the entire budget for the sponsored projects within the division or the unit that you're working in. You might have some responsibilities in onboarding new faculty and postdocs. This is not kind of globally true, so your role that you have in this kind of might be minimal depending on where you're at. And then lastly is processing invoices from the subrecipients. So any of these subcontractors that you have will kind of send you an invoice and say, this is the work that we've done and how much we're owed for it. And you just make sure that they get paid according to the contract that you have with them. And then lastly, some different kind of career options. So generally you start as an assistant RA, do that for 2 to 3 years, and then move on to associate RA. And then a couple of years later, then you go to full RA. As PhDs, you can pretty easily leverage your credentials to kind of skip the assistant RA position, which is what I've done. So I jumped straight to associate RA. After you've done about anywhere between 5 to 10 years of research administration, then there's kind of a number of different pathways that you can kind of take this. So the most obvious is just move forward to the next step, which is senior research administrator. An adjacent offshoot of that is a grant specialist. So instead of kind of doing, you don't have the financial / human resources component of it. You just kind of focus specifically on the grants and sponsored projects coming through. Within grant specialists, you can be a specialist in pre-award, post-award, sub-awards, or contracts and negotiations. Another kind of adjacent offshoot of that would be division administrator. And so then you manage kind of the operations of the entire division as opposed to just the sponsored projects portion. And then the right side of this, I've kind of, it gets a little murky. There's a lot of different options. So if you kind of decided that you want to be a little more involved in, the research components, maybe not like the research itself, but be involved in the projects, you can always use this and go to something like a research project manager, a research program director. You could feasibly become department chair at a smaller satellite school or a community college. Or a dean of research. And there's a lot of arrows missing in here. So you could go from division administrator, department chair, kind of a lot of different routes that you can take within this, web on the right-hand side in the bottom. And then lastly, just some general, career tips that I found useful when I was getting to the end of my program. Talk to your school or your department, see if they have a career development office. They can help you kind of explain, they can describe to you some of these different career options because they're familiar with what some people are doing outside of this and can help you kind of personally cater resumes and cover letters and so on. And then the Versatile PhD, I've included a link for it here. If you go to their career finder and look in, most of you will be on the right-hand side here, non-academic careers for STEM. There's a lot of different routes that you can go with your PhD that they have listed. You see research administration here as an option. But if you click on these links, it expands and it has sample resumes, testimonies from people who have kind of gone this route with their PhDs, things like that, little details about the job as well. And with that, I will leave you with my email. Please feel free to take this down and contact me with any questions if we're not able to get to them today. Thank you.
Thanks so much, Micah. If anyone has any questions for Micah, please leave them in the chat now. But I have one for you, which is, how do you think your PhD helped you prepare and excel for this role?
Yeah, so a PhD is not necessarily required for this role, but it does help you, first of all, just having a background knowledge of how the research process works and just understanding how critically important it is to have every detail in place, because having even a small thing out of line can be the difference between funding and not. And so understanding, sorry, there's a fly in my mouth. Understanding how that works is critically important. Also, you can come in with background research knowledge. So I particularly joined infectious diseases, which is not within my field of expertise. But if you happen to join, if you're a research administrator for a division that is your expertise, then you can kind of help with some of the scientific components. A lot of PIs are open to having you help write some of those portions of it, or at least contributing to them. And the more work you can kind of help the PIs with these grant submissions, the more they're going to like you and the better you're going to do in the career.
Okay, that's really interesting. And then there's one question from Sarah Light. It's quite a long one, so bear with me. It's, do you work with individual PIs on their individual research grants, or is it mostly dealing with very large grants and projects that are submitted at a higher level and involve a wider range, like many different research groups?
Yeah, so it's both. So every PI in the division is going to have, you have like the big RO1s that are multi-site. You have large industry sponsored grants that are almost always multi-site as well. And then you have smaller, like for the newer PIs who are putting in some of the smaller industry sponsored grants, or the smaller, like R21 2-year grants. So it's a very wide variety of, what type of proposals you're going to be helping to submit. The large ones are more complicated, but it's really good to kind of stimulate your brain and kind of, it's a fun challenge. And then, yeah, you have just a wide variety.
And then it says, do you work with the researchers to help them write their grants?
So I personally do not. That is something that, I've talked to other research administrators who have had PhDs and have gone into research administration in their field. They do help write the science portion of it. I personally don't. I handle the administrative components.
And I guess this question might not be relevant, but do you then co-author papers with PIs if your contribution is substantial, or are you more just very much away from the research side?
Yeah, generally no. I mean, it like I said, it's very much on the administrative side. You don't have a lot of involvement in the research, although you can. I mean, if a PI is open to it and you're wanting to contribute that to it, that's something you can definitely discuss, and a lot of PIs are open to it.
And I guess one last quick question is, do you know if this role is available in other countries apart from just the States?
That I'm not sure.
Yeah, I think it really depends. No, I think it really depends on the country you're in. For example, in the UK, I think you could maybe have a similar role, but you're working for the funding body instead of the university. But I could be wrong. And I think the person who will actually be able to answer this question the best is Josie. So thank you so much, Micah, for your really, really excellent presentation. You really appreciate your time. And if there are any questions that you haven't answered, please feel free to just answer them in the chat box.
Thank you.
So yeah, now we will move on to Josie. Josie just finished her PhD at the University of Manchester, and she will tell you all about the slightly different role that she does in academia now.
Thanks, Rebecca. So yeah, I'm a research manager at the University of Manchester, and I've been in post since January, so pretty new to the role. A bit about my background. So I did an undergrad at the University of Nottingham in biochemistry and molecular medicine. I knew I wanted to do a PhD or further research quite early on. So my second year, I did a 8-week summer research placement. I didn't do a PhD straight away because I hadn't decided what subject to do it in. So I took a year as a DNA sequencing scientist working at a small industry company. And then during that time, I applied for PhDs and I got my position at Manchester as part of a Centre for Doctoral Training Program in regenerative medicine. And in the beginning of this year, I finished, and my subject was neuroscience and developing novel therapies for hemorrhagic stroke. And unfortunately, although early on I thought I knew I wanted to do a PhD and do research, I quite quickly decided it wasn't for me. I didn't like when experiments didn't work, so I thought about other career paths quite like as soon as COVID hit, really. So initially I thought I wanted to go into patent law and be a patent attorney. So I took some initiative and I contacted the law school and asked to follow some law courses. I networked with other qualified patent attorneys, and I eventually decided that's not for me either. I also worked mainly to get money, but also just for exposure and networking as a consultant for pharmaceutical consultancies. This was sort of desk-based research, reading literature and compiling data in spreadsheets, and identifying data sources for that pharmaceutical company to do secondary studies. I also worked for Proteintech part-time as a field marketing representative, so this is a marketing role, organising events, increasing brand awareness and feeding back to the central team. And towards the end of my PhD, I realised I wanted to do management. So I interrupted my PhD for 3 months and worked as a research management intern for a newly created brain research centre in Manchester. So this was just providing general management assistance to the manager, working on a patient and public engagement landscape project, and helping to develop centre strategies around equality, diversity, inclusion, and PPIE. So now I work as a research manager for the Brain Inflammation Group, which is the group I did my PhD in at Manchester. So it's a bit of a weird way to get a job, but basically I had the idea for the role in late 2021, about the time I was doing my placement. And I was already doing some things in the lab in our group to help run the group, really. So I basically told my supervisors to make a job for me when I finished. So we wrote a job description. I applied for it with my CV and application form, which is standard for Manchester jobs, interviewed, and I've been in post since January. So a bit more about my group. It's not your usual academic research group, it's a very big group. So we've got about 50 to 60 people. So we've got 11 PIs from varying levels of just now having the first PhD students to our group leader who's probably had 50 plus PhDs, 15 postdocs, 23 PhD students. Well, this will be 33 next week. We've got 10 more this year, and 2 technicians. So the case for management was quite strong. And our research spans from basic science. So we have some people in the lab doing cell biology, looking at mechanisms and in vitro models of disease. We've got people working on animals, so doing translational work, looking at stroke and Alzheimer's disease models and developing therapies. This is where my PhD was sort of based. But we also have clinical researchers. So we've got a few clinical academics and consultants who also supervise PhDs. And they sort of work on understanding human disease, mostly stroke and brain tumours. And also we use human tissue, so blood and brain samples from post-mortems. So the main part of my job is really building capacity within the group to increase our outputs and the quality of our research. That's sort of what I'm trying to sell myself as, so people continue to give me money. So I sort of work at all stages of the research lifecycle, which obviously starts with funding. So the main part of this is looking at grants. So identifying opportunities. So if someone says something about, if I see an opportunity about a small grant, a big grant, all sorts of grants. So it could be research projects, programs, it could be fellowships. If I think an individual in the group could benefit from an opportunity, I will let them know about it. It could be events and outreach grants. And obviously send these to the researchers and say, do you want to apply for this? Can I help you? And the sort of help I provide with this, it can be stuff like cost estimations, so try to work out how much, what their research proposal is, how much it's going to cost, and is it feasible to fit that within the timescale of the grant, and how much time do they need to budget for all of the activities. I've also been involved in writing sections or even whole grants. So I'm not that far away from the research. So unlike Micah, I will have input to the grants. I'll even maybe highlight study design issues, maybe even the PIs have missed. I have had an idea for a grant. I found an opportunity. I was like, we should do this. And I've actually written that whole grant myself. Unfortunately, my name can't go on it as I'm not academic, but I do have a lot of input to that. and also involved in reviewing and responding to reviews on grants. And as part of the funding process is also to fit with external and internal approvals. So I liaise with the research support teams. So it's the other formal costings team. So I suppose this might be similar to what Micah does in the US. Yeah, the whole research support in Manchester. We've also got business engagement and contracts teams, technology transfer teams. So if a project has any intellectual property associated with it, we have to talk to the tech transfer office, and the governance team as well. So if it's a study involving human participants, we need to get ethical approvals. So I might be involved with making study documents for those and getting the protocol together and just chasing the PIs. And then onto the research itself. So this I do probably less of. The majority of my time is spent on the grants, which is obviously building capacity. And then during the research itself, I do a bit of lab management, which is basically making life easier for the PIs. So it's governance things like tracking animal usage. I made a SharePoint or intranet for our lab so we can centralize all our documents, keeping on top of health and safety and that sort of thing. Managing any human tissue that we have, because there's quite a lot of governance around how you record things like that. But also pushing forward some initiatives that I myself have decided are important. So updating and developing sustainable practices for the lab. So trying to get our lab more green, more environmentally friendly, and trying to improve things as a culture. I also do a bit of admin, so organise our meeting schedule, which is harder than you think when you've got 50+ people to get in a room at the same time and get people to speak, and helping new starters settle in. And then post-research, I've not really done as much of this yet, as I've only been in post for 9 months, but I will be involved in the outputs. So this will be writing reports to funders, ethics committees, collaborators about how the research is gone, publication writing and manuscript review. I don't know if I'll necessarily be named on the papers unless it's been a grant that I've literally written half of, because I'm obviously not doing the science myself, I'm not in the lab. But I'll probably be involved in some of the review process of these, and also updating the public website. And then obviously an important part of science research cycle is impact and engagement, which again I don't do that much of at the moment, but I'm hoping to build. So I will be the contact for our group public engagement activities. As a group, we do quite a lot with the public, and although a lot of our science is preclinical and not necessarily clinical research, I want to network with other researchers in Manchester and build a network of public contributors, so we make sure our research is meeting the demands of what the public and patients will want us to do. And then overarching all of that is research strategy. So it's a bit fluffy, but it's basically thinking about where we are, where we're going, and how we're going to get there, and what we need to get there. So thinking more about the medium and long-term plans of the group. Like for what requirements do we have staff that are on short-term contracts that are going to leave? How can we keep them? Do we need more technicians? Is this equipment going to break? Do we need to think about like the longer-term plan of how we can keep things going at such a quick turnover? Also thinking about large centre grants. So you sometimes will see big grants come up for like several £1 million for several different themes within a site. So I'll be organising how we can make sure we're being included in those themes. And then a bit differently, but also improving the diversity and inclusivity of the group, which is another initiative that I have put forward as something we should think about. So trying to get more people from underrepresented groups into research. So I have a bit of freedom to do things as I think are right. So I set up this summer a 4-week programme for students, undergraduate students, to come in for 4 weeks to do a mini research project, and we recruited 2 students from underrepresented groups, and that was really popular. So hopefully that'll be something we take forward. But there's a lot of freedom in my role to do whatever really fits within this overall remit of research and building capacity and improving the culture. So things to remember are research management is a new role with no defined path. So I found this quite hard at the beginning of my role because the role was created for me, but there's no one, I don't line manage anyone, and the line manager above me is the group leader. So there's no other support staff in my group. So I do end up doing a few bits of everything, which are not necessarily part of my role. People just may see me as support. But yeah, there is no defined path, not like the STP where you can just progress up. There's not a defined way. And also permanent jobs are scarce in academia. I myself am on a fixed term contract, which will hopefully be extended, but that's all dependent on funding, and permanency is scarce. So my options are really to stay in my job, obviously, step sideways or step up. So in the NHS, there are project manager jobs, which are similar, but maybe more focused on one particular project. These are at various levels. I could be going to clinical trial management, which I think you may have to go into at a lower stage and work as a clinical trial coordinator and work up, because you may not have the specific experience. Or the scientific advice roles within NIC. Oh, I could stay at the university. There's some research and development roles at various grades. And these sort of work on overall strategy, more what I mentioned last is the research strategy. So helping researchers get big grants in, or there's other levels of project management roles. Or, which is most likely at the moment, is to lobby again for a new role. I want to get some more line management experience for the next positions. But I don't know how that will go if I just ask for more money. And other things that I could do, I mean, I still have some interest in intellectual property roles. Sales marketing is always there. I don't know how good I'll be at it, but I have some experience and I have good networks, so that's something I could think about. One thing I'm not so sure about is industry research management or pharmaceutical research management. It'd be great to have a permanent job in GSK or AstraZeneca, but I don't know how the management systems work within those companies, but it's definitely something I'll think about. And also science policy. And I guess I'll add the STP back onto that list, because I also applied for it out of undergrad, was unsuccessful, and went and did a PhD, but maybe I'll think about that again. So yeah, that's all I have to say. Basically, think when you're thinking about careers, think about really hard about what you enjoy about your job, what don't you enjoy, and think about what jobs are out there. There's always, I'm still finding new jobs that I didn't know exist, and I'd always go just search for jobs every month or so and save the job descriptions and see what skills you might need for the next jump, and you can start to build that into your current job. So yeah, that's all me.
Thanks, Josie. That's really interesting. And I definitely second what you said about looking for your next role and making sure that you're looking at the skills that you need. I think this role, you sound unsure, but I think this role will be perfect for a lot of the things that you've already highlighted. Even if you're not entirely sure what they are, you can network with people that have that role. You can have informal conversations with them over LinkedIn and try and find out how it maybe differs from your research manager role. I guess there are quite a few questions, but I think maybe you can answer them individually. But I guess a more kind of broad question is, how would you say this differs compared to a traditional postdoc? What have you found the hardest to adapt to?
It differs in that I'm not in the lab, I'm not doing any research, so I'm sort of like a support, like I'm helping to find the grants, I'm helping apply for the grants, but I'm not going to be doing the research, which I find quite hard. Initially, like some of the work I'm writing grants for, there's one project I'm specifically managing or involved with, is really exciting, and I love the science, and I'm a bit regretful that I can't do the science. And I've applied for a whole grant, which is, you know, a really cool study. We're getting tissue from patients and testing a new drug on it, and it's a really translational important step. But I can't do that. And though it was my idea, I can't like do it, and that's quite hard. I suppose I could. My supervisor would probably let me because I have the skills to do it, but that's not within my job anymore. So I guess that's kind of hard to adapt to, because I don't know, I feel like a lot of people hate their PhDs by the end of it and hate research. But then after you've submitted your thesis, like it gets a bit better. So maybe that. But I guess also starting in a new role that no one knew how to use me to start with. I got quite bored in the first few months because I wasn't busy. No one, like, because everyone, the academics had just done that work themselves before, and now they have me. They didn't know what I could do. But now it's got to a point where it's fine. But that was to start with the worst.
Yeah, I can definitely imagine that it's maybe because it's a new role that's hard to adapt to. There are a couple of questions if you'd like to answer them individually in the chat. But Thank you so much for your time, Josie. I think you're going to go really far. I know maybe seems a bit daunting because it's a sort of fixed term role, but honestly, I think this is a really excellent position. And if anyone else is interested, do reach out to Josie and maybe ask her how she lobbied for it, what her reasonings were, and how she was successful. And then last up, we have Dr. Claudia, who is going to talk to you about her role as a project manager.
Thank you. Oh, you guys see my screen?
Yeah, you just might
Okay.
need to make it full
Yes.
screen.
Okay.
Perfect.
Yeah, perfect. Thank you. Thank you for having me here. I want to talk to you a little bit about my my career journey here. So I was sorry. I was born in Mexico City, and I first got interested in science because I went to a science fair that was called the Week of the Brain, and I was completely in love about the brain, neurons, and all that. And that's when I knew that I wanted to study something that was related to the brain. I started to look for schools that had some kind of programs that were teaching that. And I found the psychology school who has this program that is behavioral neuroscience and psychology. And that's how I started in this field. So I enrolled in the school. I started to very early in my career to work in science. I had the opportunity to do also my undergraduate research project, where I learned how to do stereotactic surgery, inducing Parkinson's disease in animal models, and then also implanting cannulas direct into the brain to administer locally drugs and see if they will be helpful for the movement disorders that these animals have. And so that's how I really started to go deep into the research field. I was very, very interested in neuroscience and all this. I knew that I wanted to know more about drugs. So I graduated with an honor thesis, and I started to look for what's next. So at that point, I thought, okay, I'm going to enroll to a master's program. And I started to find which schools in Mexico had something related to drugs. So I found this program in pharmacology. And I, after a very tortuous mechanism of to get into the school, I finally got to be accepted in this program, and I started to work in again things with movement coordination, Parkinson's disease, basal ganglia. I started to study about receptors, and every time I went deep and deep into all these things that we do when we are in a master's and also PhD. So I went into study neurocircuitries, and after that I continued with my PhD because at the school I couldn't just go straight for the PhD. I had to first earn my master's and then get the PhD. So I earned the master's and I enrolled to the PhD. For the PhD, I continue with the same line of work, but this time trying to work more in deep on like signaling pathways, receptors that were involved in these circuitries that help us to move, and that are very important in neurodegeneration and movement disorders. So I started to work a lot in molecular biology. I also started, not started, but continue with my behavioral work. So I got a pretty good set of skills, and I got a lot of data, a lot of publications. And as a matter of fact, by the time that I was pretty much graduating with the PhD, I had a lot of much more work than I had before. I had to wrap up papers. My fellowship ended when I graduated, and I still had things to do in the lab, and I continued to do stuff in the lab, and I was really thinking what will happen next. I didn't thought about I'm going to find a postdoc, which in my mind was the only thing I could do. But now I know it's not. But at the time I thought, well, I need to look for a postdoc, but I didn't start it on time in my mind. I thought that I was delayed compared to my peers, that they were looking for a postdoc, and some of them even had a postdoc when they graduated, and that was not my case. And so I was completely lost when I finished my PhD. I didn't know where to go. I didn't know what to do. I also needed to pay my bills, so I started to look for alternatives to start working. And so I applied for a lecturer position in a university in Mexico, the School of Medicine, Anáhuac University, and I got the position. So I started to teach, and I was teaching for 2 years, and this less than 2 years, but it went like almost 2 years. I was teaching clinical pharmacology, courses like pharmacokinetics, pharmacodynamics, psychopharmacology, toxicology. And although I thought that I would hate it, I didn't. I really like it a lot, but I still missed doing science or research. So I started to now that I had a job and I could like think straight, I started to look for a postdoc and what were the ways to find a postdoc. So if you are in neuroscience, you will know that a lot of people say, if you are looking for a job, Society for Neuroscience annual meeting is a place to go. There is a lot of job offers there. So that's what I did. I went to the annual meeting. I presented my work. And in there, I met this guy who came to my poster, a very funny person, Robert Lutke. He was working in the UNT Health Science Center in Fort Worth, Texas. And he was working more like in molecules, drugs. He was in the area of drug discovery. He offered me a postdoc, and I started to talk to him about what the projects were and everything. He was looking for somebody that knew about physiology of the basal ganglia, which I knew, and he was more like a chemist. So he had been developing all these novel compounds to target precisely those receptors that I studied during my PhD. And he offered me a postdoc, which I accepted, and I was very happy because I felt like I was failing in something for not having a postdoc. I came into the US to work in this lab. I learned a lot about neurochemistry, a lot of my molecules. And but now I was kind of detouring from my thing, right? Like I started to now work more like a chemistry settings, knowing like how to tweak a molecule to make it more selective for something. And I wasn't entirely happy with that. So I talked to him and say, hey, we need to establish some collaborations or something so we can start working these molecules in vivo. And that's how we met in an annual meeting to Dr. George Riebeck, who was working in Indiana University, Bloomington. And Dr. George Riebeck was working on electrophysiology in vivo. He was recording neurons while an animal was performing in a task. And so I thought that was super cool. We started this collaboration with him. He, after several months of this collaboration, he actually offered me a position because his postdoc was leaving and he needed somebody to take over that position. And so he offered me a second postdoc. And so I packed my stuff and very happily went to Bloomington because I really loved the work that Dr. George Riebeck was doing. So I went there and I learned much more about electrophysiology, especially physiology in vivo. He was working with Huntington's disease, another movement disorder, neurodegenerative disease. And I started to learn a lot more about neurons, network connectivity, data curation, a lot of data stuff, which it was new to me. And I also had the opportunity to be a lecturer there. I started to teach psychopharmacology. When I had 2 years in there, Dr. George Riebeck nominated me for a promotion, which I got as an assistant scientist. And this position is meant for you to start kind of your own path as a scientist, start getting funding to be able to work in your own line of research. Unfortunately, the thing that I didn't know is that the visa has so many limitations for grant funding eligibility. So I tried to change my visa. It was not possible because George was about to retire in a few years. So there were a lot of issues that came with the visa situation. So George and I had this conversation, and he was like, you should look for another position that had more time open for you to be able to change visa and do what you need to do to be independent. So he actually contacted me with a person who was looking for a research assistant professor to manage, to be managing a core facility of electrophysiology. And so after a few months of talking and discussing, we did it. I moved up to Indiana University, but now in the campus that was in the city in Indianapolis. And so I started to take over I became kind of the manager of the electrophysiology core there. And I got a very good skills managing that, because I had to do multiple projects at the same time, do data analysis too, and also some mentoring. And I got a lot of experience in managing procedures, especially prioritizing projects and all that. So at that time, I learned for a friend that there was this open position in the IU School of Medicine, and they were actually looking at project manager. And I thought that it was a good opportunity for me, because after all these funding issues that I had, I even wasn't sure if I wanted to continue as a PI and get fundings and be stressed out about it. So I thought that this was an alternative path for me, where you can still do science, but you don't have to be all the time applying for grant funding. And so that's how I ended up in Model AD. Model AD, it's a consortium that was funded by the NIA, the National Institute of Aging, by NIH. And it consists of many institutes, Indiana University, Jackson's Lab, University of Pittsburgh, BioSage, and also in California, University of Irvine, California. And so this consortium, what it's doing is to generate new animal models that are more translatable to the human condition in Alzheimer's disease. And this happened because NIA was thinking we are giving a lot of grant funding to things that are not working, basically. And many of the clinical trials were failing towards the cure of Alzheimer's disease. So there was this multi consortia that they generated, this consortia that is basically trying to focus on doing a more directed research in a more rigorous way, and also in a more standard, with more standard procedures. And that's how I ended up here. Now my job is I do some mentoring to staff and students, but basically my job is to establish standard operating procedures, managing multiple projects, and be able to delegate and prioritize to do some data analysis and curation, and getting all the data in shape for uploading, because one of the most important parts of this consortia is the open science ecosystem. So we make public absolutely everything we do, how we do it, and even if we use and specific reagents or companies, we publish that too, so people can replicate this and can do it, as opposed to what had been happening, that it's a lot of issues in replicating results. So we are working on that, and now I am not really, although I have my projects, I don't have to necessarily write grant funding. And I think this is an alternative for me. It was a good alternative for me, because I also didn't want to be stressing out all the time about that. And so I still do what I like. I love research, and I can also do it without the worry of like not becoming a PI or having funding. So I think that is a very good good thing for me. And one of a few things that I would like to just say, it's some helpful tips probably for you guys, is that a network is super important, collaboration, and that's how you see other people. Like, people can reach out to you when they know you, but if you are in a shell, well, it won't happen. Try to always acquire new skills. Down the road, they can be very helpful, like it was for me. And also always try to look for a better position. And the most is least, but not the least important, is maintaining work-life balance. Try to enjoy what you do, and to find something that actually adapts to what you want and not the other way around. And with that, thank you so much for having me here. Here are my information, and if you have any questions, I'm happy to respond.
Thank you so much, Claudia. You've clearly had a really interesting background to get to where you are today. So, like, congratulations on sticking through it. And I was just talking to Frida, and she said that it really resonates with her, like feeling lost and not really knowing what to do. So it's great to see that you've had so much success off the back of this sort of uncertainty. One of the questions is, of your extensive background, are there any key skills that you think helped you feel more prepared to be a project manager? And did they help you be a competitive candidate for this position?
Yeah, I think the best set of skills I got was when I was managing the core and electrophysiology, because I was not necessarily doing my own research, but rather doing research for other PIs and people in the department that needed to do something. So it kind of got me in a position of like multitasking, doing a lot of projects at the same time, which I didn't have that experience. So I think if one set of skills it could be helpful for this type of job, I would say is to have the ability of managing multiple projects at the time and be able to succeed in all of them. Try to prioritize always, and be very, very schedule oriented, so you can actually manage all that things in a short period of time. I think that was from all my background, I think that was what really helped me when I was managing that core, because I had so many things to do and I felt like I had no time for anything. So I started to prioritize, and I started to kind of make a better organization, get better organizational skills. And I will say that's for this type of positions, I think that's a key.
Yeah, thank you. And one more question before we move on to the open group chat, is where do you see your career moving after this role? What are the future opportunities available to you?
Yeah, I'm really happy where I am, but I also think that if in a future I would like to move to industry, it's something that I could do, since I have now this experience, and also I like to continue in the research field. So it's something that I could do. So really, in this position that I am right now, it's I would say it's very convenient. It has a lot of flexibility. In time flexibility, it also allows you to do what you like without the pressure of having like to be sitting in a desk writing grants for it, being able to do your own research. And so it's a way that you can continue to do what you like without the pressure. And this positions also comes with better salaries than a postdoc. So I think it's also a plus. So you don't have to. Oh, of course, it's not like an industry, but it's pretty decent too.
Okay, thank you so much for your time. So the next point of the agenda is that I'll just have a really quick company presentation. And then following on from that, we have a 5-10 minute slot for an open discussion with the panelists. So if you have any open questions that you want to ask the panelists, get them ready now. And then in 2 minutes, we will be able to show those. So really quickly, I'm just going to do a quick company presentation. So at Proteintech, we are really proud to have over 200,000 citations of our products. And our predominant products are our antibodies, which are made in-house, and we have them against over 13,000 human targets. As I said before, we also have our ELISA kits and our IHC kits. So if you are in the market in life science for a new reagent, do you think of Proteintech?
Hey, Rebecca, sorry to interrupt, but we're seeing
okay.
your presenter slides, not
how
the
annoying.
presentation.
Okay, let's try that again. Thanks, Sophia. Is that better?
Yep, that's perfect.
Fantastic. Sorry about that. Click the wrong desktop there. And then just moving on with our products, we also have our humankind, cytokine, and growth factors. So these have enhanced biological activity, as you can see here, in comparison to a competitor protein, which wasn't generated in human cells. You can see that these are really excellent. We also have them in cGMP grade, so that means that they are suitable for cell and gene therapy manufacture. And then alongside our humankind and Proteintech brands, we have our Chromatech brand. And so through Chromatech, we sell our nanobody reagents. So these are things like nanobodies for immunoprecipitation. Here you can see where our GFP trap is used for pull down of a GFP trap protein. And you can see how clear the band is. And it's one of our most popular and top cited catalog products ever. So if you are in the market for a new immunoprecipitation reagent, then do think about our Chromatech brand. And one last thing before I move on to our group chat, our group question session, is that we recently launched a antibody labeling kit. This is what we call our flexible antibody labeling kit. And the reason this is so popular is because it enables you to multiplex antibodies from the same species. And the way that it does that is that it's an affinity linker bound to either a fluorophore or an enzyme, and that binds in as little as 5 minutes and produces a fully functional homogeneous antibody. And that means that you can then, say, multiplex 3 rabbits or 3 mice antibodies without having to go through the whole primary and secondary antibody incubation step. So it saves time, as well as being a really neat way to multiplex antibodies. So again, if you are interested, do reach out to us, or you can find more information about our flexible kit on the website. And for everyone that's attended today, you are able to apply for a free sample. I will send this link out in our follow-up email. You can also scan this QR code on your phone if you would like to fill it out now. And you are able to apply for a 20 microliter antibody, a nanotrap, or a humankind protein. And if everyone on the call would like to the panelists, if you want to unhide your cameras, and we'll see if there are any questions. I've unfortunately lost all the question tabs. So I guess one of the questions is from Alicia, and it's, what is the best way to find less traditional positions like these? It seems like a lot of you stumbled into them, so how would one go about looking for this kind of role? And I can either pick on someone to answer, or if anyone has the answer right away, please feel free to reply.
I sort of jump in here. So.
Oh no, go on.
Yeah, I was just going to say, I think you've got to try doing different things. So while you're kind of still studying, try volunteering for different things and work out what you like to do, as was kind of reiterated earlier. Just find out what kind of things, what skills you like using, and then, because I don't think you can go straight to a job. Even a job, you never know what a job's like until you actually do it. So it's about trying to get some experience while not being in the job and working out what you want to do, really.
Yeah. Josie, did you have anything to add?
Yeah, basically that. During my PhD, I tried a lot of different things. If there's something you think you like for me, it was patent law. I was like, we're definitely going to do that. Started teaching myself German during lockdown to help with that. But then I audited the course and I was like, actually, I don't like this. You talk to people. If there's something you think you want to do, network, try and find as much out about it, and then get the skills, and then you might change your mind. It's that happened to me like 3 times. So, and also, if there's something you already like doing, if it's like for my job, I basically made myself indispensable, so they had to employ me afterwards, so they needed me. So if that's something you're already doing, maybe you can try and convince people that they need you.
Yeah, I think that's a really good point, and definitely about networking, and just like I think Josie said as well, writing down your skills, figuring out what you like. You'd be surprised what roles are out there. I know it seems scary, but there are always things out there that you're not aware of. And then another really good question, which I think resonates to everyone here because we've all done PhDs, and it's when you leave laboratory research jobs, how do you deal with the fact that you might have wasted many years working in the lab and all that time that you've wasted?
So I can say a little
Micah?
bit about this, if you don't mind.
Yeah,
Don't
yeah.
jump on anyone's toes. Well, hopefully everyone's enjoyed their PhD at least a little bit. So even though I'm not working in academia anymore, I still, looking back, even though it was stressful, it was still a very enjoyable time of my life. Like, I enjoyed the research and the lab work that I was doing. But I think you just need to focus on the transferable skills that you've got. I think that's what's really supported me in my current role, because during a PhD, you've got to manage your own project. You can bring that to sort of any position. So you need to know your time management. You need to be able to organize yourself. Obviously, communication is key as well. So if you're presenting at conferences or delivering a poster, doesn't really matter what field you're in or how you're communicating, you still need to be engaging with other people as well. So I think it's all about drawing on the skills that you've gained during your PhD, even if the skills you're using in your current job are not exactly the same. That's probably my advice.
Yeah, I think that's really good. Does anyone else have any?
Well, I just wanted to say something. We tend to think that in the PhD we are doing so specific, and sometimes we feel like we do a lot, but so narrowed in one direction that we feel like we don't have a big picture. But we actually do, and what Rhys was saying is absolutely true. We have a lot of transferable skills that we don't even know that they are, just because we use them in a very specific set. But we have a lot of skills. We have the ability to present work. We have the ability to communicate science. We have the ability to write. We have the ability to work in a lab set. So we have a lot of skills that we think that we don't have, but we do. And also, if you go to industry type of job search, you will see terms that you are not familiar with, but it's basically what we do every day in the lab as a PhD. So I think we have to also try to erase that from our mind, that we are doing very little or we don't have skills. We do have them, we just don't call them like an industry is called.
Yeah, I think that's a really good point. Micah, do you have anything to add about perhaps like the idea that you might be wasting time in the lab skills and how you maybe cope with that?
Yeah, I mean, I think it was covered very nicely by Rhys and Claudia. The only thing that I would add is it really just depends on what you want to do. If research is something you're passionate about and you've really enjoyed your research experience, maybe look for jobs that are along those lines. But if you feel that you're ready to move on and want to do something a little different, it's kind of the whole like don't cling to a mistake because you spent a lot of time making it. So if you don't want to do research, move on to the next thing and just be okay that you've built those skills, because there's a lot of transferable skills that you develop in research.
Yeah, I think that's really clear. And that's actually what a lot of the comments are saying right now. And one really good question that I've been asked before when doing careers webinars and talks is from Teresa saying, although we do get many transferable skills in our PhD, how do we convince future employers to see them? What would we put in our cover letter? How? I can answer this after someone else, if anyone else doesn't want to jump in.
Well, I can talk from maybe a STP perspective, and I think I briefly mentioned earlier that there was a person specification. So it might say in that person specification, demonstrate that you can analyze data. Like, that's a very simple way they might ask it. So you can just bring in your PhD there. So as long as you have an experience that sort of hits the mark of what people are looking for, that's a good way of demonstrating it. If you're just putting a cover letter out there without a job specification, you can look at what that lab does already or what that team does already and see where your skills fit in with that team. So that's my advice.
Yeah, that's a really good one. And I think I'll just quickly highlight that. So what I recommend to people when they're applying to a job, if they might not think they have all the skills, but what you can do is look at exactly what that job description is saying, and then perhaps mirror that in your CV and cover letter, but then answer it with your own examples. So you can underline key skills you have, or say it's asking for really broad project management skills. You can say, I'm a project manager because I've done X, Y, Z managing the lab whilst I was doing my PhD. Or if it's asking for communication, might say excellent communication. You can say, well, I'm an excellent communication because during my PhD, I presented at lab meetings, I went to conferences, I spoke to a wide variety of a wide audience, for example. So perhaps generating from, if you did a Pint of Science event, like one of Praveen's, that's really excellent way of showing that you can talk to a wide range of people, not just scientists. So there are many ways that you can talk about transferable skills, but I highly recommend mimicking what's written down on the job description and also underlining key phrases, because unfortunately people don't have time to read your whole cover letter or read your whole CV, resume. So don't be afraid to put things in bold, highlight them, underline them, make sure that they can see the answers that they're looking for. Does anyone else have anything to add to that about transferable skills and helping employers see them? No. I'm just trying to look through all the questions. Oh, there's a really good one here. It's like, thank you for sharing your insights. And in terms of work-life balance and caring responsibilities, could you comment on how your current roles compare in comparison to your experience with academia?
Yeah, this is going to be very different for all of us, I'm assuming. In my position, I can say that my work-life balance is significantly improved in research administration. Again, you get the remote work and you get the schedule flexibility, and most of that stuff is pretty rigid in graduate school. So the workload is a lot heavier in my academic experience than what I have now, and I enjoy the work-life balance that I have more in my position now.
I would say it's the same for me, actually. I think I touched upon it earlier, but I very much do the 9 to 5, which I think a lot of people might think sounds boring, but actually it's great. I've got a good work-life balance at the moment. During those 3 years of training, it's a bit intense because you're covering, I don't know, master's degree, you're covering your training portfolio. I'm trying to learn as much as possible. But now that I'm kind of stable in my current role, it very much is 9 to 5.
Yeah, I can attest to that as well. I'm not currently a carer for a child or anything, but I know that my counterpart in the US, she has a child, and she very much has said that moving from academia to working for Proteintech, she has a much more balanced sort of caring capacity as well, so she can spend more time. Again, I think it really depends on the role. In general, I would say industry is better. You're also a bit more protected. You have sort of a wider HR. Academia, sometimes you get more pressure just from one person, whereas in industry or in sort of when you're part of a wider network, whether that's like Josie and Micah, that you're working for actually the university, but you're not under just one PI, so you've got a lot more protection in that respect for ensuring that your work-life balance needs are met. I think that might be all the questions. Does anyone here have like one last comment that they want to say to everyone listening? And then I think after that we can just say thank you and log off. No? I think, yeah, it's been quite a long one. So thank you to everyone who stayed to the end. And thank you so much to the speakers for giving up your time. The comments have been amazing. Everyone has been incredibly grateful for your insights and for your knowledge in helping them try and find a bit of an alternative career. And yeah, good luck to everyone in your job search if you're listening. And yeah, thank you so much. Bye.